All right, everyone. I'd like to welcome you tonight to the Rocket Nation. We're honored to have Governor Hutchinson on our campus this evening. But it's always great to have the governor on the campus of SAU Tech, and we've been working hard to advance what I call the real LA, Lower Arkansas. But no, we do our job at this little institution as part of the SAU system to advance educational opportunities and advance our growth as a state. And with great pride and honor, I'm so humbled to have the opportunity to introduce our governor, who has shown great leadership during this most trying time. He's been a steady voice, an advocate, and a fighter for the people of Arkansas. So please give a warm welcome, a Rocket Nation welcome to our Governor, Asa Hutchinson.
Thank you. Chancellor, thank you, and it's great to be on your campus again. What a beautiful campus. And I know just talking to some of the students, they're excited about the school year starting again. I see Dr. Trey Berry. Where are you, Dr. Berry? Back here, and thank you for your friendship and leadership and being here tonight. I know we have some educators here. The mayor, thank you for your hospital. Where's the mayor? Yeah, Mayor. Thank you for your welcoming spirit here. And we got our hospital administrator, we've got some of our medical professionals, we got citizens here, we got teachers here. And I know we got people that might feel more comfortable up there, so I'm not going to make you come down, but we do have chairs here that we certainly welcome you here. So a good crowd tonight. Of course, I'm joined by Dr. Jose Romero, who's our Secretary of Health, but he is a key real national leader in terms of pediatric epidemiology, which is pediatric medicine, and has a good national role, but it's really been a good guide for our state throughout this troubling, difficult last year. So I wanted to spend a little time with you tonight. I'll make some comments and then we'll turn it open for questions and comments that you might have. And the whole idea in these community COVID conversations is to have frank discussions, to hear from people and raise questions, and hopefully we can provide answers, or at least we'll hear from each other, and be respectful during that, through that time. And of course, that's the only thing I ask, is that we respect one another's viewpoints and that we listen and we have a conversation, and I think that is important. First of all, let me go through where we are right now, and I always like to put it in historic context. So June, July, August, so it's just right a little bit over 65 days ago on June 7th, let me tell you where we were here in the state of Arkansas. On June 7th, we had right at 1,600 active cases here in the state. On August 12th, we had 24,000 active cases, going from 1,600 to 24,000. If you look at the daily cases, on June 7th, 65 days ago, we had 62 new active cases. Today we had 2,318 new cases that came through COVID. Hospitalizations went from 175 on June 7th to almost 1,400, which is the highest hospital census that we've had for COVID patients since the pandemic began. And so what is the reason for this dramatic change? And of course, you know, when the legislature met, we have Speaker Matthew Shepard here. Please welcome Matthew Shepard. He's there. The Speaker's been such a leader in the state. He has been a great partner throughout all of this. And whenever the legislature met in regular session, we were at a low point. It looked like we were through the pandemic, and everybody hoped that was the case. We felt good about it, and so we changed some things. Well, in hindsight, from my perspective, that didn't look so good in the sense that we now have the Delta variant that's caused this huge uptick in cases, And it's not just Arkansas, even though we were on the front end. It hit Missouri first, and then that Delta variant hit Arkansas, and now you see it in Mississippi, and Mississippi was asking the other day for the federal government to send in a U.S. ship that would help in hospital space. You see Texas and Florida getting overwhelmed in their hospital because of COVID cases and other hospital needs, and we're pushed to that limit here. So it's not just an Arkansas challenge, but it is a national challenge as well. And Dr. Romero does not know when it's going to go down. I think that's safe to say. And I do not know when it's going to go down. And we see some national estimates as to maybe it's going to go down, but the data does not show that yet. And there's a sense of urgency because we have school starting. And we want to have a very successful year. We didn't close down our schools last year. We kept them open in classroom instruction, but it was still a challenging year that we had. And we want a much more successful year this year because, let me tell you, those students need that classroom experience. They need to be with the teacher. They need to have that learning opportunity, and we want to do everything we can to make that successful. And from my standpoint, I believe that vaccinations are one of the ways that we can get out of this current situation with our cases going up. You know, under the Trump administration, they did an incredible scientific endeavor with our pharmaceutical companies that produced a vaccine in record time, but the FDA looked at all the data, all the studies. They gave emergency use authorization. We started getting the vaccinations out. And if you look at those, what we were losing was our nursing home residents. Well, we worked to get those vaccinated first, and when we got those vaccinated, we started seeing those cases go down of our elderly citizens. I got my vaccination. Others are hesitant about that, and that's one of the things that we can talk about. Let me first look at where we are in our vaccination rates. I set a goal that by July 30th, we would have 50% of the entire population in Arkansas vaccinated. Well, we didn't make it, but we're now to the point that 19 counties have reached that 50% vaccination rate. And I want you to know that Ouachita County is one of those counties. So give Ouachita County. And I wanted to show what it looks like in the counties. And I think we're going to show this on the graphs here. And so, boy, that's going to be hard for you to read. But this is Ouachita County. And first of all, this is the age 18 and over. So this is not the entire population. This is the age group of 18 and over. And the dark is CAMDEN itself, the city, and then the white is Ouachita County. And on the left side, you see those that are partially vaccinated, and on the right side, those that are fully vaccinated. And so if you look at those that have been at least one shot, you add the 44% with the 10%, so you have right at 55% almost of 18 and over that's been vaccinated here in Ouachita County. You all have worked hard. You all have got that vaccination rate up, so that's good. Let's look at some of the other counties, though, in the surrounding areas. What's next? I got to look at the graph here. Somebody got good eyes, got to tell me what county that is. All right, so this is, thank you, Dallas County. And Dallas County, fully and partially immunized, you add those together, is 57%. If you look at the next county is Calhoun County, and you can see that's not as good. That's 36%, Calhoun County. If you look at Union County, that's 40% in Union County. If you look at Columbia County, that is 45% in Columbia County. And so you can see this whole area as to how we're doing in vaccination rates. And of course, many of the counties are behind the statewide vaccination rate. But then if you look at the nation, we're behind the national vaccination rate as well. If you look at Vermont, 68%, Massachusetts, 64%, Maine, 64%. Southern states are not doing as well. What's the reason for that? That Alabama has a 35% vaccination rate, Mississippi, 35%. And so the southern states are not doing as well. Perhaps it's because we don't trust government. We want more information. Perhaps it's because we have a more rural population. But those are some of the things that we want to address tonight as a community. And so with that, I could say more, but I'm going to stop because I know there'll be a lot of questions that come up. And we have our microphones here. If you've got a question that you want to ask or a comment, feel free to do either one of those. We got people over here as well. So does anybody have a question or a comment? Yes, sir. Yep.
Thank you, Governor. Thank you to SAU Tech. My name is Gregory Nettles, Nettles. I serve as a pastor in this community, Bethel African Methodist Episcopal Church. You know my bishop, Bishop Michael Mitchell. I also serve as the president of the Camden Area Chamber of Commerce. I have one statement, then I have a question. I'm a firm believer that our biggest problem is not the pandemic, it's not the border, it's a crisis of truth. And the reason that it's a crisis of truth is because people are not willing to tell the truth. And so as a leader, I would encourage you to tell the truth. My question is, a lot of people are not taking the test or the vaccine because they say they don't know what's in it. Is there a way in order to release on the Arkansas government what are the ingredients in that? My response to that is people don't know what's in Kentucky Fried Chicken, but they eat it. So is it possible?
Yes, the answer is yes. And Dr. Romero, you've got a microphone there, which I'm grateful for. So Dr. Romero, what's in the vaccine?
So all the ingredients of the vaccine can be found on our website. It's also available on the CDC website. And for me to run down the list would be somewhat ridiculous at this point. But we can tell you what it is. It's open knowledge. We can give that to you, sir. And I can get that to you. I'll give you my card after we're done here with the governor, and I'll send you the information.
But it's on the Department of Health website.
Yes, sir.
And it's on the CDC website. But that's transparent as to what's in the vaccine.
Thank you for that transparency. I've been vaccinated, so is my wife and my children. We're fine, but it's for those out there that are using the excuse, I need to do more research. So can that be something that can be sent to the media so they can get the information out there, particularly in this area since our numbers are high?
The answer is yes. It's probably will be a little bit hard to translate into the media, but I was trying to think of the right way to do it. We'll get the information to you, and then you can utilize it in your community as needed. And Jordan, did we bring any of any written material? Okay. And we have the Department of local Department of Health here as well. Where's our local Department of Health, Dr. Oh, right over here. Could you introduce yourself, please?
Yes, my name is Jeremy Courtney. I'm the Regional Director for the Southwest region of the Arkansas Department of Health.
Okay, and so let's make sure we have that information available so that if you want to go to your local health unit, you can get that information as well.
Absolutely.
All right. Who's next? Yes, sir.
Thank you, Governor, for letting us meet with you tonight and speak with you. I would like to voice what your charts revealed. You see that there is a significant opposition to the vaccine. You didn't state the Arkansas rate. I think it's around, what, 35, 40%, but you cited Alabama and Mississippi. That's more that have not taken it than have. And I understand this is a very volatile issue. It involves our health. Everybody wants to be healthy, but the reality is we have disease. I have a strong opposition to the vaccine, and I have a question for you related to one particular aspect of it that really, really troubles me tonight. But just to explain a little bit, I'm opposed to it because there's some real apparent dangers with the vaccine. It's a genetic material injected into your body. It is a new thing, never been done before. They do not know the effects, long-term effects, and there's already been some medication problems. Another one is that the New England Journal of Medicine just released the first initial evaluation of effects on pregnancies. This has not been talked about very much, but it's New England Journal of Medicine published it in July that a group of women had been vaccinated, 127 in their early trimester, first or second trimester. Out of 127, 104 lost their babies. That's 82% rate. That is terribly alarming. That's something that ought to be investigated, and it's not even being talked about. So, but my real concern is there's opposition, there's dangers, there's concerns. My real concern is the mandates of this. And here's my specific question. Tyson Corporation and Walmart have recently announced that they will mandate this for their employees, corporate employees for Walmart, all employees for Tyson. I know that because I'm a pastor and one of my church members just received a notification. State law says in Code 26103 under Public Health and Welfare, an adult minor, married minor, or emancipated minor may make healthcare decisions for himself or herself and give an individual instruction. This is an important part of our law. We've always protected our freedoms. Hospitals can't violate this law. You know, you go in a hospital and you can be sick and dying, but they can't make you take anything. But we're now poised, our businesses are going to do this. My question to you is, as governor, will you take action against these companies that are violating state law to protect the rights of employees?
So what law are you citing there?
Title 20, Public Health and Welfare, it's 26103, part of the Arkansas Code.
Could I see that?
Sure. It's the basis, what I understand, of our right to make our own healthcare decisions that hospitals have to respect. No doctor can violate it. My point is, they say private businesses are private, but there is freedom there, but it's always limited by law, and they can't violate the law. So that's my objection.
No, all right. First of all, thank you for the spirit of your question and your comments. I think that's fantastic, and I'm very grateful for your sincerely held convictions and how you expressed them today. First of all, I want to talk about the mandate issue and the business issue, and then I'll ask Dr. Romero to respond. And we have Dr. Smith here that I'll ask her to respond from a local standpoint from her experience on that. But in fact, let me start with them first. And so the question was about the risk associated with the vaccine. So Dr. Romero, can you comment on that?
Yes. So the conclusion of the article, which I believe you're quoting, says that their preliminary data, and I'll add to that, did not show obvious safety signals among pregnant persons who received mRNA COVID RNA vaccines. There's been a recent report from the CDC that strongly endorses the use of those vaccines in pregnant women. And we know for a fact that pregnant women are at greater risk for adverse outcome. And that risk is not just for them, but it's also for their unborn child. And so a woman that becomes infected and is pregnant has a greater chance of having an adverse outcome, and when that happens, the baby is at great risk. So to date, our data does not support the fact that this vaccine is dangerous in pregnant women. And it's been supported by articles in the New England Journal of Medicine, the Journal of the American Medical Association, and yesterday by the CDC, who made a strong-throated endorsement of the vaccine.
And then Dr. Smith. Oh, here you go. Yeah, go ahead and use that microphone there. That'd be great.
So I do believe that, I do appreciate your questions, and thank you for coming, and thank you for expressing them, because without more information on the information that people need to make good choices, we can't give you what you need to make those choices for yourself and your family. So thank you for that. I will say, I'm trying my best to remember each of those discussions. The number one thing being that it is genetic material. It's not DNA. So that's the first thing I would like to speak. It's mRNA, so it's called messenger RNA, and that is something that we naturally have. The virus has RNA, and that's why we utilize the RNA to vaccinate against. And so that material, our bodies have it all the time. It's in the cytoplasm of the cell. It never enters the nucleus, which is the area of the cell that your DNA, your genetic components are stored. It never enters the nucleus where your DNA is stored. mRNA in and of itself has a half-life. So the mRNA that's in that is coding for the spike protein, which is, when you're looking at illustrations, the red dot that hangs off the outside of the virus in pictures. That's the spike protein. That when that's injected, its half-life's estimated between 6 to 24 hours. So within 24 hours, that mRNA is degraded, just like our natural mRNA has a half-life. All human body parts have a half-life. In general, total as a sum, I think average is 70-something years. Red blood cells, 3 months. So each part of our genetic makeup, our body's makeup, proteins, enzymes, they all have a certain time that they last, and then they degrade. And mRNA is no different. The mRNA in this vaccine, like I said, best estimates are between 6 to 24 hours. It's no longer detectable. So it cannot interfere with your DNA or your genetic composition, and it's only there so long before it's degraded. Now, how it's used, your body's own ribosomes will make spike proteins, and then those spike proteins are degraded by the immune system. So there's nothing really left after these degradations. So there's nothing there's no evidence theoretically that could affect your genetic makeup at all.
Okay.
Would be that.
That's good. Did you have anything else?
That's it. But the pregnant study.
Okay, go ahead.
So the vaccine can't protect you from other things that will cause you to lose pregnancy. Going over the study that I believe that you referenced, there weren't 300 people in that study. There were 35,691 people in that study. And so of that study, best estimates, even beyond vaccinations, are 1 in 4 pregnancies end in miscarriage in the first trimester. When you study women and just pregnancy test them all the time, up to a fourth of them may not have even known they were pregnant. So naturally occurring pregnancy loss. Now, that being weighed, within this study that you're referencing, it's no more apparent in the vaccinated group or the unvaccinated group. All the data right now on pregnancy is very safe, and there's actually evidence to show that women that are vaccinated in their 3rd trimester, their babies actually have antibodies to COVID. So not only is it the preliminary data safe in pregnancy, but it also suggests that mother will confer immunity to her newborn infant that can't be vaccinated.
Okay. So, I think we ought to all get an associate's medical degree. That was a great medical education. Thank you very much, Doctor. And just from a layman standpoint, and I'm a layman, I'm not a doctor, but I do like statistics. And if I look at the statistics in Arkansas, of those that have been hospitalized, 93% of all hospitalizations in Arkansas because of COVID have been from those that have not been vaccinated. And that speaks a lot to me. And I agree with you, sir, that everything is about measuring risk. And there's some things we don't know. But if you look at measuring the risk, we do know what happens and the risk of getting COVID and having serious consequences from it. So that's a little bit of how I evaluate it. The final question, I'm going to give you the microphone back because you've been very patient and listened to us if you got another point to make. But you ask about the the mandates. First of all, there's no state government mandate in terms of vaccination. And so the vaccination, whether you or anyone else gets a vaccination, is your decision. And all I can do is have town hall meetings and talk about how I think it's important for our state. But it's an individual decision that you make. In terms of the businesses, there's not any mandate, and I would not support a prohibition on businesses directing their own workplace, whether you're looking at a hospital that needs have a safe environment and doing everything they can for the protection of their patients, or you're looking at a nursing home in which but child could not go in and see their family who's in the nursing home because a staff person was not vaccinated, and so COVID spread, and so they had to keep any family from visiting family members in the nursing home. And so there's an interest, if a nursing home made that decision, that's their prerogative to do that. And so to me, that's an issue of freedom for private businesses, that they can make their own decisions, and I'm not for a government mandate telling that private business what to do. Now, you've been very patient. If you want to have a follow-up question or comment.
Yes, I want to press that issue because with businesses doing this, saying it's their private right to run their own business, we always limit that by law. Freedom is always limited by law. And Walmart or Tyson, if they begin to violate civil rights of employees, you would take action against them. That's civil rights law. This is the same thing. This is health decision rights law, but we are now preparing to let them run over that and totally disrupt the lives of many Arkansans where they will be without a job. And this will start with Tyson and Walmart. It will go, if it starts, we're at a threshold. It will go to the rest, and this will really tear up the fabric of society.
No, I think that once they get FDA approval, you might have more businesses that will require it, particularly if the Delta variant continues and our hospitalizations continue. I think you're right on that point. I think more businesses will make that decision, and it's tough for the businesses to make those decisions, and it's tough on the workers, but they usually give them an option. You know, you can be vaccinated, or you can be tested, or you can wear a mask. I mean, but it's up to the businesses. Thank you, sir. Very good questions and comments. What else? Over here we have someone, and then I guess back over here.
Hi, my name is Alana Fife. I've been a nurse for 26, 27 years. Worked the front lines the whole entire time in emergency room and with immigration. My concern is we're losing our nurses. This is already forced in hospitals, many. Some still give you the choice. You have a choice. You can be a nurse, or you can lose your profession that you've done. You have no way to support your family anymore. This is being forced on us. You have a right as a nurse, as a woman. If you get pregnant, it's your body, your choice. You can abort your baby. But I do not have the choice if I want to keep my job and work in some hospitals. Also, I thought it was my body, my choice. I don't want a poison forced into me, so I have the ability to keep my job. So my concern is, are we losing our nurses? Yes. They're fleeing the profession. We're already in a huge nursing shortage. If anybody works in medicine, you know we don't have enough nurses to take care of our patients as it is. And say you have 75% of your nurses taking the vaccine. Most, because they're scared of it. I talk to nurses every day. And the rest of us are saying, you know, is it really worth it? Is it worth whether it's a fear or not, me taking a vaccine that I'm not comfortable with, since I'll be losing that right, the way things are looking, and pushing towards that. I can abort my child, but I don't have a choice to get a shot. So we lose our nurses, 25% of them. You already don't have enough to take care of the people you have. You lose 25 more nurses, percent of it. Who's going to take care of all these sick people that we have? Who's going to take care of each one of you? When you come to the hospital, I'm gone.
Okay.
The rest of them are gone. There's only 25%. Those nurses are already getting tired, and they're dropping out. The ones that have the vaccines are quitting. They're worn out. They can't handle the workload. Who's going to protect our nurses?
Do you have that's a good comment. I appreciate it. Do you have a question or is it just a comment?
How do you plan to protect our nurses? I've heard a terrible, terrible rumor that possibly funding the hospitals a lot of money to bring outside nurses in, which I hope that's a terrible a lie or a rumor or whatever, because it needs to go to the people that have been affected by it, their jobs and their livelihoods.
First, in terms of the nurses, they have done an incredible, incredible job, and you're right, they're strained, particularly those that handle COVID patients. And in terms of what we've done to help them, we just allocated, I think it was about $97 million to our hospitals to help retain nurses, to make sure that they have competitive salaries so they're not going to a contractor, that they'll go somewhere else out of state and make more money with an agency. So we're giving the hospitals money to help in the retention of nurses. We've done some other things, but that's sort of the key thing. But we have a hospital administrator here. Where are we? Okay. Can you comment on what are you seeing with nurses and the strain that they have, and what's the reason for it?
Agreed. Everyone in the healthcare industry, they do have strain at this moment. You can see it on people's faces. You know, people are overworked. I would say also in other industries around here too, with different mandates and whatnot, people being out of work due to having COVID or whatnot. I think you also have that type of strain. But agreed with you, people are, you know, everybody in society, I think every sector feels this impact right now. Shortages here in Camden, like any other hospital, we do have, you know, issues and whatnot depending on the wave of COVID patients. But I would like to think that, you know, our hospital here in Camden's handling it, you know, the best they can. And we right now don't have a vaccine mandate at our hospital. Just, you know, it's a person's own volition if they take the shot or not. So that's kind of where we stand.
Okay. Well, that's, so do you work at, where do you work?
I've already fled the state
I'm
because the
sorry,
pay
what?
wasn't good enough. I've already fled Arkansas as a nurse. I work Louisiana. I do have my license back in Arkansas to do multi-state. So I am looking at traveling outside of Arkansas already because of the poor pay in Arkansas for nurses here.
Yep. Okay.
Unfortunately, I mean, I love Arkansas. I'd love to stay. You know, looking at Rogers, Arkansas, looked at taking a job there. But they not only are forcing or encouraging the vaccine, you can't work there unless you take the vaccine.
Yeah.
You do not have the right to refuse it religiously or medically.
So you're working for an agency that has traveling nurses?
Right now, well, I just resigned at Ochsner's in Louisiana, at Medical Center of LSU, Ochsner's LSU in Monroe. I work for an agency that does travel and work with immigration and everything. So,
Great.
yeah.
Well, there's great demand for nurses. I don't think anybody's going to have a hard time getting a job. Such a need for it. And some nurses, they're frustrated because they're having to deal with COVID patients, and they're saying, I wish you'd have got a vaccination because I'm stressed out on this. So it's just a challenge in the healthcare market, both for those that want everybody to get a vaccination, then you got others that don't want that. And so thank you for sharing that. And we had a comment right here. Yes, ma'am. Well, first of all, this gentleman here, and then we'll come to you.
Governor, I want to thank you for your wisdom and leadership in this very trying time. I appreciate very much what you're doing, and I would say the same with the people that you've surrounded yourself with. As you say, Dr. Romero is a remarkable figure in this state and nationally, so thank you. We have 6 grandchildren. 4 of them are 12 and older and have been vaccinated. When can we expect the shots to be available for the other 2? And how do you think 12 and under, well, 5 to 12, getting the shot will impact this current situation?
I'll let Dr. Romero comment on the 12 and under as to where they are in the review process for that.
So the studies have been done. They're being analyzed. I think that we're going to be able to have a vaccine for children before the under 12, before the end of the year. As is typical of the FDA, they have a very measured serious approach to the analysis of the data, so it's not going to be rushed, and you can rest assured that the data will be safe if the vaccine will be safe if they go forward and authorize it. So I think by the end of the year you'll have that. How will it impact what we're seeing now? I think it will have a great impact with regard to the number of cases we're going to have. The governor and I have talked about this, and I've expressed my concern that in the school environment we will see outbreaks, and until they have that vaccine, it's important for individuals to voluntarily use a mask. That's the best way of protecting yourself at this time. And if you're 12 and above, get the vaccine, because that will prevent the spread in that 12 and above age group.
Thank you, sir, for your comment. Yes, right here.
My comment was, I have a daughter that's a traveling nurse as well, so not taking away from the validity of what you're saying. What the governor said is true. It's kind of two sides to that. My daughter is frustrated because she's worked mostly COVID floors in Louisiana, Mississippi, Arkansas, and a lot of the nurses are leaving, but they have the opposite issue. They're frustrated because people aren't getting the vaccines, and because they feel like the majority of the patients that she's seeing are patients that are unvaccinated, and sometimes people that have other illnesses, cancer and other things, can't get a bed because the beds are blocked up by people who did not get the vaccine. So it's just, I don't know the answer to that. Hopefully
You're
you do.
speaking as a mom of a nurse.
As a mom
so
of a nurse. I don't have any scientific data, but
You've
as
got
a mom of a
credentials.
nurse, yes.
Thank you. Yes, sir.
Hi, I've been known to be loud, but not that loud. My name is Rodney Fife. I'm a local resident here in Ouachita County. I had 3 short points I'd like to make, and then I have a question for you, Governor,
All right.
if you don't mind. On August 1st of this year, Dr. Anthony Fauci, who is the medical advisor to the President of the United States, went on Face the Nation and made a very profound statement. He stated that according to CDC data, virus levels in the nasopharynx of the vaccinated were the same as they are in the unvaccinated. He went on to say that we know now that the vaccinated people spread the virus to others. So this information alone kind of does away with the unvaccinated spreader incident and the get it done for your neighbor, family, or friends when we know that this is being done among those that are vaccinated, primarily talking about the Delta variant. We also know that these primary vaccines were all based off the B.1.1.1.7 alpha genome sequencing of the original virus. So common sense will tell you that as you go along, the more mutations you get, the less effective that is going to become. You don't have to be a virologist to know that. The herd immunity issue, this is why it has disappeared from the talking points, because they know that that is no longer a case. We're dealing with more of like a flu-type situation now than we are with a smallpox or something that you can take care of and get rid of because the mutations are so fast. And of course, we have a wonderful working scenario of this in the country of Israel. Second point, to take this shot, you have to sign a form. And I would be willing to bet money that there's an indemnity clause in that form that releases the manufacturer from any kind of liability should something happen, such as a side effect or severe reaction to this shot. Now, I wondered why that was the case, but then I got to looking and remembering that there was a law passed in 1986 called the National Childhood Vaccine Injury Act that covers all vaccine manufacturers complete immunity to legal. They have to go through the VCIP and all that.
All right, let me stop. You've made 3 good points here, and I know you got a question, but let's have some answers to those 3 points there. Is that all right? And then we'll come back to you.
Yeah, I didn't have any questions. I was just making statements. But
Oh, okay. I
that's
thought
fine.
you had a question. All right, so let me cover those before we lose track here. Dr. Romero?
Yes, sir, and thank you. Those are very good questions, comments. So with regard to shedding from the individuals that get the vaccine and become infected. So the vast majority of individuals that get the vaccine will not become infected, will not carry the virus in their throat. So by immunizing a large population of individuals, you are reducing the number of individuals that will eventually shed that virus. So the vaccine works, and the vaccine was not designed to prevent shedding. That was never in any of the trials that were studied. What the vaccine is designed to do is to prevent serious disease, and we know that the vaccines continue to do so. They decrease, and as the governor presented was data, that they reduce the probability of you being, if you are infected, of going into the hospital, and most importantly, death. So the vaccines work. They weren't designed to prevent shedding. With regard to you bring up a very good point about the parental strain. That is the strain that gave rise to the vaccine. So the part of the virus that is being used for development of the antibodies is relatively conserved. They do change over time, and that's how you get those variants. Those variants are still susceptible, that is, they are able to be blocked, reduce the disease by that parental vaccine. So it works. Does it mean that that vaccine will not have to be modified sometime in the future? It'll probably have to be modified. So that's not unusual. That's still, we see that with our vaccines. You have that as a living proof in the flu vaccine.
The flu vaccine, that's modified from year to year.
That's exactly. So we're seeing what we expect. And I'm sorry, your final point, I'm not sure that
It's on the release that's signed and the immunity of manufacturing companies for vaccines.
Yeah, so you are correct. This law was passed, and that was passed because of the concern that vaccine manufacturers were receiving a lot of lawsuits against themselves. So the federal government said, we will set aside a large amount of money for which you can go forth with your attorney and show your case and be compensated for that. So we do have that mechanism, and that mechanism exists today for the current vaccine. So those of individuals that have damage from the vaccine can plead their case and be granted compensation.
I didn't want to cut you off. Did you have anything else?
Yes.
Go ahead.
To the point of that is the indemnity is because it's still operating under EUA, therefore it's not covered under the 1986 law, and that's why if you're having to sign this form, you don't have to sign this form, you get medications from your doctor, but you do for this. Last point in question for you, please, sir. We know that the Pfizer, Moderna, and J&J all used aborted fetal cell lines, specifically PERC6 on the J&J. We know that it was in the research and development on the Pfizer and Moderna. Knowing this fact and being a Christian and understanding of how some people's feelings are about this, how is it that you feel comfortable asking someone who does call himself a Christian, believes strongly in their values, to allow this substance, knowing that aborted fetal cell lines were used in either R&D or production, depending on which one you're talking about? How is it that you feel comfortable about asking them to allow that material to be injected? Thank you.
Thank you, and thank you for the question. I am pro-life. I've signed every pro-life bill that's come to my desk, and whenever I became aware of that issue, first of all, it's my understanding, and Dr. Romero can follow up on this, but it's only the J&J vaccine that had that cell line, and the others did not. But then the J&J vaccine, and I respect your decision, and that's, anybody can come to that conclusion. There's a number of Baptist ethicists, Christian ethicists, that looked at the issue as well and said it was okay to get the vaccine. They were not saying that shouldn't be done. Dr. Romero, am I wrong in what I'm saying there?
No, what the governor is saying is correct. Of those vaccines that were mentioned, the J&J is the one that used a fetally derived cell line. Now, I want to add a fine point to that. So the cells that are being used were derived decades ago. These are now cells that grow on their own in a petri dish with the right substances around them. So fetuses are not being aborted to produce the current vaccines, right? No fetus is being taken in order to use to create the new vaccine. These are cell lines that were established decades ago.
And it still could cause someone a problem, but you have an option. So you might make a decision not to get this particular vaccine for that conviction, but there's 2 other vaccines that are available. All right, these are really great conversation pieces, and so I've got a question right here, and
Yes,
I'm going to hear from that back row before the night's over. I got a feeling.
I'm
Yes,
curious about the, if we have a breakdown on the people. We know the vaccine is what's going to help us through this. I'm wondering if we have a breakdown on the demographics of the people who are not going to take it, but by age or income or city, urban versus rural, of the folks that are declining to get the vaccine.
And the answer is yes. I don't have all the data right in front of me. And by the way, we do have 2 pharmacies that are out front that have been there for a couple hours, will be there for some more time. If anybody did decide they wanted to get a vaccine, that's available to you this evening. And so back to the question, Dr. Romero, do you remember the question? I got to.
What's the breakdown? Why
The breakdown, sir.
people that aren't taking it? Is it young people or old people or what?
Well, there's been some polling data. First of all, the elderly are at the highest vaccination rate because they saw they had the greatest at risk. And so 65 plus, they rushed in there, they got vaccinated. That's our highest vaccination rate. Those that were between 24 and 40 or in the middle range, they for a long time thought they were immune and they weren't going to get it, they were healthy. But now we see that the average age of those who are in hospitals is about 40. And so that's starting to increase. Obviously, the younger is just really getting going, and that vaccination rate is going up. I think the question I can't answer better, though, is why is there resistance? What's the reason for it? That's been polled. Part of it is distrust of government. Part of it is misinformation. Part of it is delay of people. In my review, there's probably 15% of people that are hardcore that'll never get the vaccination. They probably wouldn't get flu vaccination, and they're just opposed to it, and that's not going to change. The rest, it'll be a slow process, but they're the ones that are learning more. They're waiting. Some of them are waiting for FDA final approval, and so the more education we can do out there, I think we'll increase that vaccination rate among that population. Dr. Romero, do you have anything else there?
No, that's correct. I think everything you said.
All right, so thank you, sir. And what else? Yes, sir.
I wasn't going to say anything, but I couldn't hold it. By the way, welcome to Calhoun County, Governor. You are in Calhoun County. We're not in Camden, but...
Hey, did we put Calhoun County up there?
You did, and
All
that's,
right, good.
that's the reason I'm standing, because we were low on the totem pole.
Yeah.
And and I say this joking in a way, but it's serious. If we would ban ivermectin, cattle wormer, where people wouldn't buy it, they might take the vaccination, because that's what Calhoun County's doing. I mean, and it's all over.
Yeah.
Taking cattle wormer. And I don't agree with it. I asked my son-in-law, he's a doctor in Camden. And me and my wife both was hard-headed. We wasn't going to take the vaccine. I've heard everything from a chip being in it, you know, the government going to track you, and just this crazy stuff, and I didn't ever believe that, but I will say that initially I did think it was political during the presidential election, and but I found out it was real. I mean, it shut the country down. Mm-hmm. We did things in our courthouse that, you know, I'm proud we did it, put up walls with glass and And I think it made the working environment safer, and I'm glad we did it. But it's real. This is a real deal. And my son-in-law sent out a text to my family about 3 months ago, and he knew how we felt about it, about not taking the shot. We didn't want it. And he said, if you don't take it, I understand, but I wish you would. And that's when it was coming back. So me and my wife talked about it, and we decided to take it. I wasn't wanting to take it when they stuck me in the arm, but we did, and I think it's the thing to do. Now, we can be hard-headed about this, you know, if we want to. I think it's safe. I've talked to a lot of educated people, a lot of smart people. I think you did a great job explaining it. And, I mean, I think it's time for us to get vaccinated.
Thank you, sir.
So,
Thank you. What else? I can tell y'all getting hungry. Where? Yes.
Hi, Governor. My name is Kyle Hively. I'm Director of Clinical Operations at the Ouachita County Hospital. We're glad you're here, and we appreciate your message that you're bringing. I have a 7-year-old and a 9-year-old getting ready to start school on Monday, and so I had a question with regard to schools. So in the first declaration of emergency, you issued the executive orders that allowed for some legal protection for entities that were, quote, complying with the health and safety measures. And now we're asking the local school boards to set health and safety policies for each district. Most school board members lack the knowledge and experience to make informed public health decisions on their own. It's important that the school boards and the school board members individually are aware of their legal liabilities for negligence when a student gets sick or dies after the school board decides not to follow recommendations from the health department and the CDC and the Department of Education. Many smaller school districts do not have the ability to retain their own legal counsel, and so my question is, what is the state doing to provide the resources for those states, or for those school districts and those school boards to make decisions for their communities?
Sir, that is an amazingly good question. And first of all, our Department of Education will provide resources to any school board that wants additional information or even legal guidance. And of course, the Department of Health is there that has its own. We have our Ready for Learn plan that sets out the Department of Health guidelines, recommendations for as safe a school year as we can have. And so all of that information is available. The plan is laid out for them. And I know that this is a difficult position for many of the school board members. Just like me as governor, I didn't run to be governor to govern during a pandemic. Well, you didn't run for the school board to deal with some of these issues either, and they're confronted with them. So we're trying to provide all the support that we can for them. And it's really, you know, and the same thing for, you know, it's decisions that they have to make. You know, that flexibility is given to them. They're going to make different decisions based upon what they see as information in their community on the transmission rates, on the cases, on the vaccination rates. All of those should be factors. The Department of Health will give them all the guidance that they need. I've been personally very, very impressed with the school boards with how seriously they've taken this and the actions that they've taken. They're acting for the benefit of the students, and they're listening to the parents along the way. One other thing, and this is not to push anything, we just want to help as much as we can, and so we're going to have within the next 10 days close to 500,000 masks that are more resistant masks that's going to be available and sent to the schools that are the right size for the school-age children. And so that way, if a student goes there and they want to have that, they have access to it. Or if a parent wants that, you know, for their child, that will be available to them. It'll take us a little while to get that to them, but we set that in motion as well. All right, I like to keep these at about an hour, but I don't want to cut anybody off. Was there anything else, a last comment? Ma'am, are you standing up? Oh, there, you get the microphone. Where are we at? Okay.
I'm an Episcopal priest at St. John's in Camden. I've worried for over a year about my congregation. Fortunately, we've had nobody, well, we've had 2 people that have become infected with COVID. One was the doctor, the medical health officer in this county, and they both got over it. Before I became a priest, I was a math teacher for 39 years, and I haven't heard this mentioned tonight. I've been vaccinated, but I could still carry the virus, and I could still pass it up to 5, 6, 7 people. But one thing you're not listening to, and you're not hearing, and you're not worrying about, I may pass it and I may catch it, get the virus, not be infected, not have had any symptoms, and then I pass it on to somebody. If I pass it on to 5 people, and they pass it on to 5 people, that's 25. And they pass it on to 5, that's 125. And they pass it over to 25, and that's 625. It doesn't take long before you're passing over to a lot of people. So what I do when I, being vaccinated, wear my mask, is I'm protecting you from being infected as much as I can. You're responsible for everybody in this room, for everybody in this county, for everybody in this state. Because you could get it, not get sick, and still pass it on. And it doesn't take long. You've heard the word exponential. A lot of my former students said, I never thought I was going to see exponential used in the sentence in the newspaper. And that's what exponential is. Me infected, 5 infected, 25, 125, 625, and on and on and on. So when you choose not to get vaccinated, you may not catch it. You may catch it and not have a bad case of it. But you can still pass it on. I don't think I could sleep if I knew that the person that I passed it to, that I could have prevented that person from being sick. John Donne was an Anglican priest in England, and he wrote something called No Man is an Island. Well, no person is an island. Whatever I do affects other people.
Thank you, sir. All right, so I'm going to end with, we've got a Department of Health ad of a gentleman I think you need to hear from. So let's play this, and then we can be adjourned.
I'm Anthony Lowry, and I'm from Hamburg. I was an anti-vaccine person until my whole family got sick with the COVID. There's like 10 of us that had it, and there's been 3 deaths. You know, I think back to my younger days, you know, I've done a lot worse things to myself than I think that vaccine would do to me. I don't know of anybody that's died from the vaccine. I got 3 people in my family that died from the COVID. If I'd have known then what I know now, I would have been the first one in line to get the vaccine.
Learn more at healthy.arkansas.gov.
Calhoun County and Washita County, you all have been absolutely fantastic tonight. I'm grateful for each of you that shared your thoughts, your heart tonight. Thank you for listening, and please give yourself a round of applause for such a great town hall meeting. Mr. Speaker, did you have anything? He's good. All right. With that, Dr. Romero will be here for just a minute and others, so if you have further conversation. But thank you very much and be safe.